Assalamualaikum, sir. How are you?
Walaikum assalam.
So, welcome back again in the question series. So, today we got the two questions from a follower, Daniel Joya. According to him, he asked, like, what is the left heart bypass circuit? And the other one is liver transplant circuits and other rare circuits which are important from exam points of view. So, we want your answers on these two questions.
So, thank you. First of all, thank you so much, my dear, for the questions. So, I will try to go one by one. So,
yes, the
left heart bypass.
circuit.
So, today I'm going to explain about what is left heart bypass and what is different between left heart bypass and conventional cardiopulmonary bypass. Okay. So, left heart bypass, usually we take a blood from the left heart and we return back the blood into the descending aorta. So mean we are bypassing the left ventricle, or we are bypassing the function of the left ventricular bypass through this left eye bypass mechanism. Why we need to do the left eye bypass? Sometime if you have any patient having disease and the surgeon need to fix the ascending aorta or abdominal aorta aneurysms or any abnormalities, so we perform a left heart bypass to perform a surgeries of abdominal or thoracic aortic aneurysm or dissections. Components, so in a components you need a cannulas, you need a circuit, meaning a tubings. So we need a two cannulas, one cannula which we're going to be inserted in the access side or other cannula in the return side. So usually we get a blood from a left atrium and we deliver into the descending aorta, and sometimes we cannulated the pulmonary vein, and the size of usually cannula, like in adult surgery if you talk, is around like the access cannula should be around like a 22 or 24 French even angle, or you can say straight cannula, and we give like a volume cardiac output through the left heart bypass is not a full flow, but some like a 50% flow, because the native heart is still having a ejection and is still having working. So we used to do left heart bypass by keeping the flow and the heart to be keep like in ejection phase, so we don't lose the pulsatility of the arterial lines. So we keep like a 2 to 2.4 liter flow during the left heart bypass. Left heart bypass usually used for to repair the abdominal or thoracic aortic any aneurysmal or any abnormalities, and in left heart bypass we never use the oxygenators. So oxygenator is eliminated in the left heart bypass because lungs are in a good shape, so we already get oxygenated blood. Our target is to provide a supply of oxygen blood to the lower part of the body. So in this view need to keep left heart bypass. Sometimes we use like ECMO flow. ECMO flow can be helping as a left
Sorry
heart
to
bypass.
interrupt you, sir. Can you please tell the viewers the full form, because some of are not from the medical background. So if you can tell them what is ECMO.
ECMO is extracorporeal membrane oxygenation, but here we don't need a ECMO oxygenator. So what we are used to do, like in this scenario we are not using the roller pumps, we are using centrifugal pump. We're going to comparison with the cardiopulmonary bypass routine conventional, and with the left heart bypass the major difference is we are using centrifugal pump in left heart bypass, but usually we are using the roller pump in cardiopulmonary bypass. In cardiopulmonary bypass we are using oxygenator membrane to oxygenate or ventilate the blood, but here we don't need the oxygenation and ventilation because we already getting oxygenated blood through the lungs, and we just bypassing the specific area so where the surgeon need to be worked. So we bypassing and we are providing the lower limb perfusion of the body, and in this there is no need for the oxygenators, and mostly we use a centrifugal pump which is creating which is dependent on the preload and upload. So how much you are getting, you are delivering, and the target is to maintain the saturation of the patient, maintaining the mean arterial pressure, and you can give a pulsatile flow, because you are not getting 100% flow through that. So the lower limb perfusion can be like a 2 to 2.4 or 2.5 liter flow, and with ejections. So this is actually the left heart bypass. And in left, what is the major difference of the left heart bypass? In left heart bypass, we cannulated either left atrium or the pulmonary vein. But in a conventional bypass, we are cannulating the right atrial appendage, you mean right atrium, or sometimes bicable, SVC or IVC. This is your excess cannulation. But in a left heart bypass, we are cannulating into the pulmonary vein or into the pulmonary, into the left atria, or sometimes we cannulated even the left ventricle even sometimes. And for the aortic cannulations, in aortic cannulation, mostly we are cannulating for the cardiopulmonary bypass, we are cannulating into the ascending aorta, but here we are cannulating the descending aorta. Why? We need to perfuse the lower bodies like spinal cord, intestinal perfusion, and even to the kidney perfusion. It was maintained by the left heart bypass. So this is, I think, the difference. So no membrane, no full flow, so we 50% flow is more than enough, and we keep a pulsatility with the native heart ejection, and keeping the mean pressure around 60 to 70 millimeter per mercury. So this is the main of the left heart bypass. Hope it is clear. So
Thank you so much. So now we will move to the
left heart bypass major four factor is you are maintaining index of 2 to 2.4 liter, and we are not achieving full flow with that half flow, and maintaining the pulsatility of the flow without using the oxygenator. Our target is to keep a perfusion pressure in 60 to 70 millimeter per mercury. Target is to perfuse lower limb of the body, where in the meantime where the surgeon is working on the abdominal aorta or thoracic aorta, and we can create a left heart bypass not by the routine heart lung machine. We can do the left heart bypass even with the centrifugal pump machine, single centrifugal pump. Or sometimes you can use additionally like a cell saver with that. So no need to go with a complete heart lung machine for the left heart bypass. Nowadays people are using like a small centrifugal pump with the cell saver, and they do the left heart bypass surgeries easily and safely. So guys, if you like my video, please share with your friends, with your community, and share with your community and like it. And I'm very happy that your input, your comments make me more energized, and I love to share the knowledge among my Perfusion group. And keep your momentum high, and keep questioning, and we'll try to share knowledge with each other. Have a nice and good day, and thank you so much
thank
for your
you.
questioning, Ivan.
Thank you so much, Mr. Joya, Daniel Joya, for
Yeah,
your
Daniel
comment,
Joya, thank you for your
and sir for
questions.
your answers.
Your
It's
second
really
question I will answer soon.
in a second video we
Because
will
my target usually is to make videos like clip of
not
like
a
10
longer
to
videos,
12.
but a shorter
So if you
video.
make like a 30 or 45 minutes, people get bored.
Bore, yeah.
So target is to 10 to 15 minutes more than enough.
Mm.
So people, the learner can digest.
Yeah.
So we'll go one by. So first part I completed for you, Daniel. The second part
The
soon you
liver
will
one,
see.
soon we will upload a video for
Soon,
that.
yeah, very soon we will
One
upload
thing
that.
more, the viewers, if you really like the video, like it, share it. Plus, if you're having a difficulty, there's some people they cannot properly understand in English.
Yeah.
So if you have a problem, you can comment. We will make a video in Urdu or Hindi
No,
versions for you.
Yeah, I want to give you additional some information. My YouTube channel have the options, so you will see there is a CC written. If you click that one, so it will you automatically get a translation there.
Yeah, but sometimes the CC is not correct. So if you have a problem in understanding this, you can type in the comment sections. We'll try our the best to make a Urdu Hindi version for you guys also. Keep like.
But the problem is here we have different cultural people here. Not only the Hindi.
No,
and
no,
Urdu.
like
So this is the reason I tried a universal language, so it's going to help each and every person. This is the reason I'm doing in English. Otherwise, we start with the Hindi and Urdu language in the beginning, but now as the followers are increasing from a different region of the area, so the better you use the universal
English
language,
version will be more good for that. Okay, perfect. So guys, I really hope you like the video. Do like and share with your Perfusion friends, and share it as more as you can, and keep asking the questions. Thank you so much. Jazakallah khair.